Hi, my name is Dr. Alan O'Reilly, and I'm a GP and lactation consultant based in Dublin city centre and in Foxrock. I've been performing tongue tie assessments and releases for over 12 years now. I just wanted to create this video as there can be a lot of confusion around tongue tie in terms of its diagnosis and the problems that arise from tongue tie. I see parents arriving to my clinic every day with having received conflicting advice and opinion and diagnosis. So I just wanted to hopefully simplify people's understanding of tongue tie, and I'm hoping parents and some health professionals find this video useful. So everybody has a tongue frenulum. It's a band of tissue underneath the tongue, right there in the midline, and it connects the tongue to the floor of the mouth. So normally it's not restrictive. It allows the tongue to move up, down, to the side, and in and out. And it's usually thin and flexible and attached in a way that doesn't cause any restrictions. Okay, a tongue tie, on the other hand, is when this tissue is too thick or short or tight and it restricts the movement of the tongue. So that can have an effect on infant feeding. There's some association with speech issues and general tongue function as well. So how to examine the tongue? So in order to examine the tongue, to look at the tongue tie, um, you need a pen torch or a head torch, and you need to place your fingers underneath the tongue, index finger either side, and lifting up the tongue. So you'll hear parents arrive at my clinic and they've been told that a health professional said, oh, the tongue is a little bit curled, or the tongue doesn't go beyond the lips, or baby's not sticking their tongue out. While these things can be useful, they're not enough to diagnose a tongue tie. You need to get the torch, you need to lift up the tongue and examine the level of restriction. Like this. So finger either side and lifting the tongue up. So there are different types of tongue tie. For simplification, we discuss anterior and posterior ties, and then type 1, 2, 3, and 4 is the most basic way of classifying them. Type 1 is very restrictive, right at the tip of the tongue to the gum line below. Um, type 2 is a little bit further back from the tip of the tongue and a little bit further back from the gum line below. These are both generally very restrictive ties that generally cause issues. Okay, um, and then we have posterior ties. So these are a little bit further back. Okay, further back than the midpoint of the tongue, and there can be enough movement here that babies might not have any problems. But sometimes if they're thick or tight or more fibrous, they can be problematic. So these are called posterior, so they're generally 50% or below. Okay, so that's the front 50% there, and then the back 50% is the posterior. So we have type 3, and we also have type 4. Okay, they're a little bit further back again. So a lot of these can look normal to the untrained eye, but when you look a little bit closer and you lift up the tongue, these can often be very thick and fibrous and really restrict posterior tongue movement of the back of the tongue, which can have an impact on breastfeeding more than anything else. Okay, so this is the type 4. And then this is what I call minimal tissue. So this is where there is barely any restriction at all. You have basically a layer of fascia and epithelium just overlying the muscle, and there's very little restriction at all with this type of tissue. Okay, and so when you look straight in, as I said, some of them can be very thin and they can be much thicker as well. So when they're thicker, there can be more blood vessels. Occasionally, there can be some muscle tissue there. So we need to be careful with the thicker ones. Okay, um, from a surgical point of view. And then this is a basic assessment tool used in a lot of hospitals in Ireland and in the UK, and it helps to grade the tongue tie. So you'll often hear people scoring them out of a certain number. So this is usually out of 8. So so you score them in terms of what the tongue tip looks like. Is it forked back like this one here, where the tongue is fixed to the gum by the frenulum. How high the tongue can lift in the mouth. This one lifts quite high, and then sticking the tongue out. So you can look at these in combination. Okay, so look, it's just a short video just explaining the different types of tongue tie. Generally, the more restrictive the tie, the more problems you have. Okay, so I hope you find this useful. Thank you.